Hello, everyone. This is Jonathan Chapman from the Build Initiative. We'd like to thank you all for joining us today. Due to the large size of this webinar, participants are in listen-only mode. Therefore, if you have any questions or comments, please type them into the chat box. I will now turn over the presentation to Gina. Thank you.
Thanks so much, Jonathan. Welcome, everyone. We are thrilled to have you this afternoon. And I do want to just reinforce, as Jonathan mentioned, that we have a huge volume of individuals RSVP'd for the webinar, which is just such a wonderful and telling statement on the importance of family child care as part of our system of supports for young children, particularly infants and toddlers. And unfortunately, because of that, as we were working on more strategies to make this webinar series even more interactive, we are only able to do in broadcast mode, which we were going to actually share our webcam so that you would see the individual speaking for their whole presentation to make it a little bit more personal and live, and we discovered that we can't. So we are doing a couple other strategies, and I'll outline those here in a minute, but I do just want to introduce myself. My name is Gina Capito, and I'm a consultant working with the Build Initiative. I'm working in particular in this project on this webinar series, and this is actually the third in the series. And you see there on our title slide that gives you a sense of the whole webinar series in case you have not participated yet. The series is focused on thinking about the Child Care and Development Block Grant, and particularly how we are really intentional in thinking about our investments for the block grant as well as other state and local investments in infants and toddlers in the birth to 3 period. So the whole series is focused on that. As I mentioned, this is our third webinar. We actually have a total of 11 webinars, and they're spread out over the summer and all the way through until October, and cover other topics such as professional development, child care assistance or the child care subsidy. There's a variety of strategies that are covered across the webinar. And this, in fact, which is focused on family child care, where the babies are and how we can think of more strategies to support the quality of family child care, is actually a 2-part webinar series. This is the first, and the second webinar on family quality and family child care is actually on July 9th. So we really felt that this, as well as thinking about quality supply for infants and toddlers, these are topics that we really need more than one session to dig into and bring you speakers and exemplars and really participate in some discussion on the topic. As I mentioned, we are doing a couple things to ensure that we make these as interactive as possible. And so we want you to watch for questions posed to you and your colleagues in the chat box. And there's also an opportunity, if you see the question, or maybe I don't even have an opportunity to see the question itself, but you see other individuals' responses, for you to be picking up some other ideas and thoughts and things that other states or communities are working on and thinking about for family child care. So you'll get from this diverse group of colleagues across the country and across rural, urban, suburban settings, you have an opportunity to really hear some different thoughts and ideas around family child care in addition to the content that our speakers are presenting today. So I just wanted to highlight one other aspect as we introduce the overall concept of the webinar. And as I mentioned, this is a series of webinars focused on the Child Care and Development Block Grant, specifically related to infants and toddlers. And in our first content webinar, which was in middle of May, we asked a couple questions of our attendees at that webinar, and some of you may have been on that and participated in these polls, but I thought it was helpful just to frame some of the thoughts and questions that folks are grappling with regarding family child care. And so I brought just a subset of some of the poll answers from that, these 2 questions in particular. And the first one was this idea of what are you most interested in related to maximizing your use of the new funding. And that's one of the main purposes of this webinar series, is to think about, again, not just intentionality around infants and toddlers, but how do we maximize the new investments that Congress has passed to go into supporting implementation of the Child Care and Development Block Grant. And so as you can see, the top one was this idea of increasing the supply of quality infant toddler care, which of course does encompass family child care. But then as call-outs, family child care itself and how we maximize the use of family child care for infants and toddlers. Over 1/3 of participants focused on that. And then thinking about family friend and neighbor care, which is another type of family child care or home in child care in an individual's home. Also, a large percentage of folks were really thinking about promoting equity, and as we talk some about the utilization and capacity of family child care in our country, we really start to see how important this concept of equity and promoting equity for the providers as well as the families is, in particular for family child care settings. The other question that we asked was then kind of what's our understanding of the supply for infants and toddlers. And to the two areas that at least a quarter of the audience, or nearly a quarter of the audience, had sort of the least information about was the idea of the supply of family child care. And again, we're going to talk a little bit about some national statistics on supply, and then the quality needs of family child care. So those are both very telling related to these topics. This is some of the information as we continue to build the webinars and learn from the previous webinars that we all are participating in, and we hear from you through vehicles like the poll. It's helping us to then really think about how do we make sure that we address some of these questions, needs, interest areas that you're raising for us as we work on this. So I decided to go with a baby picture of myself, and so my big smiling fuzzy peach head baby, that is me, Gina Capito. Many of you have seen my photo if you're participating in the last webinar, and so you've seen my current photo. I thought it was more fun to share the photo from the period where I would have been using family friend or neighbor care myself and been one of the participants that we are frequently thinking about quality for. And then we also have with us today, we have Danielle Fuentes Johnson, also with the BUILD Initiative, who will be presenting and sharing some of the utilization and capacity information related to family child care. And then we have Jessica Sager joining us from All Our Kin, who's the co-founder and the CEO of the All Our Kin organization in Connecticut. I'm going to let Danielle and Jessica just say a quick hello so you hear both of their voices.
Good afternoon, everyone. This is Danielle Fuentes Johnson at the BUILD Initiative. I'm so pleased to be with you all today.
Hi, everyone. This is Jessica Sager, and I am so thrilled and looking forward to our conversation together.
And so I'm not sure if everyone that's joining via the broadcast-only setting can see this, but we are close to approaching 300 participants. So again, when you're watching the chat box, which we are going to make visible to everyone shortly, we're getting through some of the questions around audio, making sure people are seeing and hearing what they're supposed to be, so you're not seeing all of the content in the chat. We're going to make that visible to you shortly. So we have not posed any questions yet. You haven't missed any content-related things on the chat. We are just getting through some of the logistics to make sure that everyone has the audio and visual that they need to have, and then we will move into. But we have a great crowd for some robust discussion in the chat, as well as hearing from our presenters today. I wanted to do just a little bit framing also of overall webinar series. There was a set of principles that the partners that are engaged in the webinar series, and you see several of the logos there at the bottom of the screen. We are partnering, the BUILD Initiative is partnering with 0 to 3 as well as CLASP to put on this whole webinar series. It is generously supported by the Pritzker Children's Initiative, and so we, as part of this work, we really wanted to think about what are some of our core principles as we approach this idea of how do we maximize investments for infants and toddlers. And so we have several core principles, and I just want to highlight a couple as part of this particular presentation. Some of the core principles, just to give you an idea, include things like being really responsive and understanding the unique nature of development for children from birth to 3, because it is so different than other periods of childhood. And then also another core principle is this idea of involving the whole child and the whole family, and really understanding that what we do, we're doing with infants, toddlers, and their caregivers and parents, that it's both aspects, both generations. And so in particular, though, for this webinar, I pulled out 2 other core principles to share with you. All the principles are part of the registration document if you had an opportunity, and we'll include that link in the chat box so that you can make sure that you have an opportunity to register for other webinars that may be important to you, topics, but also take a look at all of the core principles. But I did want to share again these 2 core principles today. That first one being this idea of all settings that serve infants and toddlers. We thought it was really important that this particular webinar series acknowledge that we didn't build a webinar series that was only thinking about or really heavy on strategies for center-based, but that we really thought about all the settings that infants and toddlers are in. And so this fits very in line with our focus today. And then also this idea of really making sure that we're focusing on equity for infants, toddlers, and their families, and that as we're building something or that we're thinking about our investments, we're really kind of getting that concept right from the start. And again, as we think about the utilization of family child care and the providers themselves, as well as who is typically utilizing family child care, this question of equity and the quality of family child care becomes even more important as a focus for our discussion. Before we jump into the content, I just want to do a quick overview of the focus of the webinar. As I mentioned, we're looking at a 2-part series. So this first part of our webinar focused on family child care is going to start with a little bit of context laying as well as getting into some exemplar strategies for building quality. But that context laying starts with this idea of thinking about the utilization and capacity of family child care and sharing some resources around that concept with us also, that we're all on the same page. I think it's clear from the huge turnout that we've got a group of professionals focused on families of very young children that are aware that family child care is a core setting, but we might not all be aware of the scope of family child care as a service provider within our field. So we're going to share a little bit of detail on that. And then one of the first strategies that we're going to talk about is this concept of the Family Child Care Network as a quality support vehicle. And so I'm going to do a little introduction to that core concept of a Family Child Care Network before then we explore more deeply a particular network model, which is Jessica's model at All Our Kin. And we're also going to talk about, while we talk about their model broadly, we're also going to talk about how they've implemented the shared services concept through their Family Child Care Network. So that gives you kind of the roadmap for where we're headed over the next hour and 15 minutes or so. So at this point, I'm actually going to turn it over to Danielle, who is going to start us out on this concept of thinking more about the utilization and capacity of family child care settings across the country.
Good afternoon, everyone. This is Danielle Fuentes Johnson with the BUILD Initiative, and as I said, I'm really thrilled to be here today with you. Most of what I'm going to share with you this afternoon is from the first national representative study of family child care published in 2015, the National Survey of Early Care and Education, funded by the Office of Planning, Research, and Evaluation in the Administration for Children and Families, Department of Health and Human Services, entitled, and we believe that it's important to share this information as it provides a framework to our conversation today, and you may be surprised by some of the numbers we're about to share. The data for this study was gathered by accessing sources either directly or through databases. Over 5,200 family child care provider questionnaires were completed by individuals regularly providing family child care to at least one child, ages birth through 5 years, who are not yet in kindergarten, all in an attempt to answer who is caring for our youngest children and how many children are being cared for in these settings. The study used the term home-based care. And over this webinar series, we are using the term family child care, but we acknowledge as an overarching concept that they are pretty interchangeable. In order to clarify what categories family child care consisted of and most accurately include all providing family child care, 3 major categories were established. Let's take a minute to briefly walk through these 3 definitions, as it will provide a scope and a setting to who is caring for our youngest children. The first category is that of listed, and that incorporates individuals who appear on state or national lists of early care and education services, such as licensed, regulated, licensed exempt, or registered home-based providers. The next category is that of unlisted paid, and these individuals do not appear on state or national lists, but were identified in household surveys as providing care. Individuals in this category receive payment for care of at least one child. The last category is that of unlisted unpaid, and these individuals also do not appear on state or national lists, but again were identified in households surveyed as providing care. They do not receive payment for providing care. This category includes family and friends who may or may not live in the same household as the children they look after. The next question the study sought to answer was, how many providers are caring for how many children, and in which version of family child care settings? These are the results that may prove surprising. When we look at listed, we see that 118,000 providers provided services for children 0 to 5 years of approximately 751,000. When we look next at unlisted paid, the number jumps significantly in both categories to 919,000 providers with over 2,300,000 children served. When we look last at the unlisted, unpaid category, we see the numbers jump exponentially. And here we have over 2,730,000 providers providing care for over 4 million children. To put this in perspective, this total number of children is 7,151,000 under the age of 5 that are in family child care. A similar study conducted by the National Survey of Early Care and Education in 2014 revealed that 6,980,000 children under the age of 5 were in center-based care. The survey also highlighted that families in higher poverty-dense areas were more greatly utilizing unlisted care, both paid and unpaid. The study and further research by Dr. Juliette Bromer at the Erickson Institute indicated that this is often due to a prior relationship already being established, the potential for cultural responsiveness, and flexibility of non-traditional hours. So we've discussed listed, unlisted paid, and unlisted unpaid are the categories, but what does that look like? How would you recognize these in your community or state? Let's look at a few examples. Listed. Examples of listed services are early Head Start, home-based, or a grandmother caring for a grandchild who also operates a licensed family child care home. An example of unlisted paid could be a nanny, an uncle receiving subsidy payments to care for his nephew, or a neighbor providing at least 5 hours per week of paid babysitting. Now, unlisted unpaid can be an adult sibling who lives in the same household as younger siblings and cares for them for free at least 5 hours per week. Falls into any category is family child care providers. They can be listed or unlisted paid depending on the state requirements and the provider status. Also, family, friend, or neighbor providing at least 5 hours of care per week can also fall into any category. In summary, what do we know right now about family child care? We know that more infants and toddlers are in family child care than in centers. We know that low-income families with non-standard work hours use this care, and about 1/3 of children in subsidized child care are in family child care. We will post the link, for those that are interested, we'll post the link to the survey in the chat box, and it will also be available after the webinar on our landing pad. I'll turn it over to Gina.
Thanks so much, Danielle. I think folks are processing, and we definitely are getting a sense of the fact that this is useful information for individuals to hear. And we've got a couple folks that are having the opportunity to share in the chat box. The question that I had posed while Danielle was sharing some of the details from the study was whether or not, if you knew the mix in your community, the number of family child care settings in your community or state compared to center-based, go ahead and share that out with your colleagues on the phone. It does, or on the webinar, it does give nice context to really think about. And for instance, in North Carolina, the comment here is that they've got just over 4,500 centers and over 1,600 family child care homes. So pretty large percentage of family child care homes to centers as well as a proportion. So that's just something that we can kind of watch for as we are thinking about this idea of how much does the national stats around the number of children that are in family child care settings relate to and compare to what you're seeing in your local community or in your state. And then, of course, as we think through some of the content that Danielle just shared, we also have to acknowledge that those unlisted, paid or unpaid, are a whole category of individuals, some of whom may be great potential to become family child care providers that are licensed and listed, and some of whom that are maybe more like the grandparents and the family members that might not be the same fit for that. And that's where I think as we think through some of the quality supports, we have the opportunity to think about how do some of these supports target the family child care providers, that getting them into and supporting them to navigate systems like licensure is a critical piece in increasing licensed family child care homes and then supporting them in building their quality. As we do hear from some of our states, and many states probably can relate this, that many of their family child care providers, as it has been an aging population, are looking to retire. And so they feel that they're coming upon what could be a crisis if their family child care providers who have 30-plus years of experience delivering this type of service are looking to leave. Are there quality homes that are going to replace those and fill that need in the community? And so that's one thing to think about, is those unlicensed or those unlisted, possibly paid providers might be a great option to get into the licensed and the QRIS system, your quality framework, to really think about supporting them. So we also have a couple other states that have listed, and I think this is huge. So in Kansas, 85% is family child care. 85% of the settings that young children are cared for is family child care settings. That's huge. And then Georgia, too, has even a higher breakdown with 3,100 centers and just nearly 1,600 family child care homes. So most of what we're sharing, and they're coming in fast, so if you have a chance to watch the chat, you'll see that we are definitely starting to echo some of the patterns that Danielle raised in that. So we're going to now talk a little bit more about this idea of quality supports, and in particular we're going to explore the Family Child Care Network concept. As I mentioned, I was going to do a little bit of context of just exploring what the Family Child Care Network idea is, the fact that it does exist on a continuum, and that it has an opportunity to provide a variety of different types of supports. But before we go into some more of that theoretical or information on the basis of a Family Child Care Network, I wanted to take a moment to pause and reflect on some of your understanding for the supports that are most needed by family child cares in your state or community. So as I said, we've got lots of folks that have a pretty good knowledge of the breakdown of family child cares to centers in their state or community. So now let's think a little bit about what are the areas of support that are most needed by family child cares in your state or community. If you could go ahead and pick the top 2 from that poll list. And because we do have over 300 attendees now, it is going to take us a little longer to do the poll, and I do want to make sure that before I move to closing the poll, everyone's had a chance. So I'm going to give you a little bit of a pause here and have you reflect on this question and go ahead and answer for me. And if you do your poll and you have a chance, then you can go over to the chat and kind of scroll through and see some of the responses that have come in from colleagues. So we had a really interesting point here from Linda in the Silicon Valley, that infant toddler child care in a center-based setting can be upwards of $30,000 a year for a family, and that is why families are using family child care. And I think that is something that is echoed in many areas of the country as well, Linda. Thanks for pointing that out. And so why it's incumbent upon us to be focusing on the quality of that setting, that it shouldn't be a second choice for families. It should be an equal quality setting. While folks are filling in the poll, I can go ahead and answer the question. The question was to define family child care once again. So Danielle shared some definitions that really were driven through the national study. So we are casting a fairly wide net for what can be included in family child care. In general, a lot of our state supports are looking at and targeting licensed or license-exempt providers, those that are registered with the state but do not need to pursue licensure within the state system, often because they're serving under a threshold of a certain number of children. And so those are kind of your typical population of providers that one might be speaking of when they're talking about family child care providers. And at the most basic level, family child care are providers that are individuals that are caring for children in addition to their own in their home. They might be caring for their own children, but they're also caring for the children of unrelated neighborhood or other community members' children. And so they're providing all-day child care to those children in their home. There are also other settings, such as family, friend, and neighbor care, which some of which may fall into the unpaid, unlisted, or just unlisted but also paid, and then more informal care settings like those that are not hitting the category of being tracked by some of the state systems such as licensure and even being license exempt or not being required to be licensed in the state. And that's why I mentioned that idea that if there's a large population, and in many communities there are, of that type of provider, they might be a robust population to engage in some of the quality supports, such as supporting them to navigate through the licensure system. And Jessica is going to tell us more about how that need came up as part of the network that's delivered by the AOK organization and what that looks like in their community. So I'll leave that to Jessica to talk a little bit more about that idea of getting providers licensed. So hopefully that answers your question on defining family child care a little more. All right, we're doing pretty good on our poll responses. I'm going to give you just another couple seconds. So far I can tell you just from watching the summary before I close the poll that, and I understand that it looks like you're only allowed to choose one. So I apologize for thinking that you could choose two. So do choose your top one support that your family child cares need in your state or community. And right now the top two are training, and then close behind it is enhanced reimbursements for serving infants and toddlers. And that's, so I apologize for some of the abbreviations. We have a limit on how long the answers can be for a poll. So IT is infants and toddlers. And there is another piece to consider as we think through this conversation, especially with such a broad population of professionals participating in the webinar. Sometimes you will hear, as Danielle mentioned, you will hear folks refer to family child care as home-based care. So that's sometimes you also hear it referred to as a home daycare. So these are all, as we are using FCC or family child care, as your state has different titles for this, can kind of consider them interchangeable with that concept. And then, of course, being aware of your state context for what defines a licensed family child care home, what are the requirements for it, because those do vary across states and communities. Oh, that is a good addition. I see that in the chat. Thanks, Joe. So Joe added that maybe one of the areas of supports that need to be added to the list is this idea that individuals that are interested in providing family child care home, providing care, may have barriers to getting started, such as zoning, local fire safety requirements. Similar to some of the requirements of licensing might be a barrier for some individuals, or they might feel that it's a barrier to try and navigate that system. So that's a great example of another support, and that might be that's not even your existing family child cares, but those individuals that you want to cultivate to get into your family child care pool. Part of navigating, and I think that maybe Jessica will speak a little bit about this idea. One of the participants raised the idea of centralized location for finding out about updates of regulations. So trying to keep abreast of things that are required of you as not just a family child care home, but even as a small business in the community, because that's many of our family child care homes, that's what they strongly identify as a small business that they're offering in their home. I'm going to give you about 5 more seconds on the poll while I just share that one of our other participants, Kathy Lipsky, shared that child care resource and referral entities are another source for supporting family child cares with some of these barriers. Navigating licensure, I would imagine. I know that that's the case in many communities. So thank you for sharing that. That's a resource that we know does exist in some capacity across all of our states. Before I close the poll, I'm just going to respond to Arlene Lopez. You guys might see in the chat that Arlene shared that sometimes a barrier is that management companies in condos or apartment buildings might not allow the business or allow folks to pursue licensure. And there are, and I'm sure there's more cities that have worked on this and used some unique strategies to try and increase the supply of family child care and also make it more appealing or kind of reasonable. San Francisco is a city that has done some work when there's new apartment developments going in where they have brokered where they have to allow so many of the units to be rented at a lower price point, and so that for individuals that are seeking to offer a family child care home through live in and then offer a family child care home out of the apartment. So getting your city's structures involved in some of that aspect of the regulation is an important one, or can be a really useful way to push on some of those issues, because that is a huge issue, especially in areas where there's lots of apartments, and that's the setting. The individuals don't necessarily own the unit, but they want to operate a business in it. They might run into other barriers. I'm going to close the poll so we can kind of keep talking about this idea of family child care network. We've got over 2/3 of you have been able to respond, taken an opportunity to respond. So you should see a summary on the screen. Unfortunately, I'm not sure if this is displaying for everyone this way, but it looks like right now all of the bars for the responses are loaded up a little high, so it looks like there's no answers next to the last 3 topics, the coaching, TA to navigate systems, and enhance reimbursements to serve IT, but they're actually the bars that are a little further up the screen. So you still see that nearly 27% of individuals felt that training was the area of support that the family child cares in their state or community most need, and then about 18% believe that coaching, and then very close to coaching at 19.4% is that last one, the enhanced reimbursements for serving infants and toddlers. And I think that this is one that often is seen as a very successful way to support family child care providers and center-based providers as well in absorbing some of the high cost of delivering high-quality care to infants and toddlers, and acknowledging that and really incentivizing them to provide that care. And the more infants and toddlers they serve, maybe they, with the enhanced reimbursements, then they're making more dollars. I'm going to leave the poll summary up for just a couple more seconds to make sure that there's no delays in everyone being able to take a look at the summary. I don't want to click away too quickly for you. And share one of the questions or comments that was raised by a colleague, and I think we're going to find this resonating well with Jessica Sager's presentation, is this idea of whether or not the supports that we're identifying are in line with what providers themselves would say. And through lots of conversations, both peer learning groups and other webinars with leaders in family child cares, that's one of the things that we hear the most from successful networks and other quality support strategies, is that the more they are built from, responsive to what the providers themselves have said through an assessment process or through an ongoing input or building the support themselves, the more successful the work is, because it is meeting their needs. So I think that that's a really nice point to make, this idea that we need to be thinking about what they don't need too, right? Not just what we think they need, and not just what we think they do or don't need, but what they identify that they do or don't need. And so I think Jessica will speak a little bit about how important that's been to their work. So just as we're looking at the summary, and I'll respond to one other question here on some of the concepts that are raised here, and it does start to lead us into this concept of what can make up the work of family child care networks, the support of family child care networks, is this idea of the concept of coaching versus training. And so we do leave them as distinct categories, and they're very complementary, and they can work together very well, but oftentimes there are kind of a set number of trainings that are offered by family child care networks, and they often are utilizing resources like the child care resource and referrals, and kind of coordinating with other resources that exist that are already delivering the trainings to support the family child care providers in accessing the trainings, and those trainings often are in response to the requirements around licensure for how many hours you need to receive in a year, training requirements for the QRIS program, for professional credentials. So there's a variety of course, requirements around training, and so making sure that folks are accessing those. Coaching and coaching and oftentimes mentoring and more individualized one-on-one support can be that next step that is working on some of the content that providers have received at the trainings and then thinking about it in the practical day-to-day work of developing their skills and changing some of their skills and practice in response to the training materials that they've heard. So I would push that maybe we do continue to think about them separate, because not all have that intensity of coaching when they offer training, and that they are kind of two different cost points when you think about trying to deliver a family child care network. And you may reach a lot of people with training and maybe reach a smaller group with that more intensive service that is coaching. If you have sort of unlimited resources, then it's possible that you are always thinking coaching and training and that is certainly a very kind of best practice approach to it, because we know that there's so much that just going to trainings, having that hands-on coaching really helps you in building your quality in response to it. So let's move forward then and talk a little bit about this broad concept of family child care networks. I want to move through some of these pieces pretty quickly, because I do want to get us to Jessica, since so much of what they're doing with the AOK Family Child Care Network is going to really bring to life some of these concepts and some of the ideas that you've all shared. Thank you so much for sharing your ideas as part of the poll and for some of the robust discussion that's happening in the chat. I almost just kind of want to pause and read all your chat comments. And we will capture the chat out of the webinar, and that's an opportunity for us to really understand some of the, if it's something that I haven't been able to respond to directly. And we will make sure that as we're putting resources out on the landing page, which is available as part of this webinar series, that you'll be able to access some of those resources. That some of them will be directly in response to questions or thoughts that you've raised, or if you've shared a resource that will make it more broadly available to your colleagues as well. So thank you so much for using the chat. We really do use it. So let's talk a little bit about this idea of the Family Child Care Network. So one of the things that the concept and kind of why family child care networks in particular for the family child care provider population is because the nature of the network allows for doing a combination of multiple services that are responsive to and individualized to the family child care provider population. So it's not saying that every family child care network is going to look exactly the same all across the country, but that instead actually what the Family Child Care Network opportunity allows is that communities and states are really thinking about, in this particular area of the state, our family child cares need more support for licensure or for engaging in the QRIS and moving up our QRIS levels, where in other areas of the state maybe they're higher on the QRS levels, and so we're looking at a different aspect of supporting their quality delivery and how we work with them. And that's what the network allows for, that sort of individualized, and it also allows for ensuring that the services themselves are really tailored to the family child care provider, because we know that it is a different job to be a family child care provider than to be a teacher in a center-based setting, and the network approach allows for some of that flexibility and responsiveness because of, again, building in the types of services that are responsive to the family child care provider and also doing a combination of things. It's not just one thing. So it would, in many instances, include both training and coaching. The perfect example. And what, in general, as an organizer is that then the Family Child Care Network is really thinking about focusing on overall quality supports for the providers that are part of the network and enhancing their capacity, and acknowledges that the providers themselves may be on a continuum, so that providers are not all at the exact same place, and because there's multiple services as part of the network can be responsive to where each provider is and kind of maybe have cohorts of providers in different places. So in just broad-based, the concept of what is a network then is a set of services that are coordinated and delivered, and they're direct supports to family child care providers. I mean, that's the overall idea for that purpose of providing ongoing support and training that is thinking about the quality and increasing the capacity of the providers that are part of the Family Child Care Network. And as I mentioned, this idea of the continuum, so there's the idea that the providers themselves may be in different places, so how they engage with and what they're working on with their network may be different. But then there's also this concept of the continuum of the networks themselves. And so we sort of think of them as an informal to formal continuum. And we are going to talk certainly more about some of the services. And I think when you hear Jessica share the AOK work, you'll start to be able to identify that it has more of the formal pieces. But we do want to acknowledge that, and this is an important as you think about building out this Family Child Care Network as a strategy, within your state or community is the fact that you may have some of these informal networks in place where a handful of providers are coming together. It might be more of a kind of a peer-to-peer, just sharing, just having somebody to talk to outside of the children and families that they're serving every day, having someone else that's doing the same job as them to kind of just bounce things off of. Yeah, that is possibly an opportunity, and particularly in the informal, is that they're not necessarily there's not an organized body that is running the services as part of the network, but that type of group of individuals coming together to support one another and are connected has the potential of developing into a more formal family child care network. And the fact that you've got a starting place of individuals that have convened in a way could be a really good resource to develop a family child care network. So I think one of the themes and one of the closing thoughts I'm going to leave you with before I turn it over to Jessica is this idea that you have a lot going on in your communities and states, a lot of quality supports for family child care, probably have some informal networks, maybe even have a formal network or two if you don't already have a strategy for family child care networks. So you have a lot to build upon. That if you do build out a more comprehensive family child care network strategy, it is not starting from scratch with everything you build, but that it's instead thinking about how do we coordinate and weave in what exists and strengthen and build those things up to be the even stronger resource for family child care providers. But just one note on this concept of the formal network. So the formal network, the group of providers usually have some sort of like a membership role, or they're enrolled in the network. And then often, typically, the more formal family child care network is staffed, and that includes staff that are specialized, so staff that have experience with family child care providers that really know the population well. There's a set of activities and deliverables that are expected because of those activities, and then there is an entity or a subset of an entity that is serving as the organizing body to support the work of the network. So just a quick look at the types of things that may vary across those more formal networks are, as we've talked about, the types of services that are offered, so whether they're offering training as well as coaching, whether there's home visits out to the family child care homes to support them in the coaching, whether they're offering release time, so either they're offering dollars to pay for substitutes so that the family child care providers can kind of come out of the home, or whether they're supporting them by making a substitute pool available for the family child care providers to tap into when they need substitute care. There's a variety of kind of differences of services. Just like when we think about services to families, though, then also the depth of those services and the intensity of those services will vary. So the intensity can even relate to the number of family child care homes that are enrolled in the network and how many family child care specialists or that specialized role that works with them, how many are they working with? Are they working with 25 family child care homes in a year, or do they have a caseload of 10? And obviously, if we just think about the intensity and kind of depth of the work that we would do with a group of 25, it's going to look different than a group of 10. We're able to more intensively serve those 10 and have maybe more of a closer relationship with the 10. So there's a variety of variances that we think about when we kind of understand the work of family child care networks and what can look different. And again, it should be responsive to the context that the networks are in and what looks different in your state and what other resources are available. We know that many states also have infant toddler specialists that are working with the family child care homes. How do these things work together well and support each other versus duplicating, but really think about that overall idea of the quality of the family child care and the service that they deliver to children. So as I said, I wanted to leave you with one thought and one thing to process a little as I turn it over to Jessica. It's this idea of what does exist in your current system that could be woven into a network, and what are that same idea of what are the existing quality supports that you're already delivering, and then maybe you think a little bit about even kind of what is your top area that you'd like to enhance or increase in this area too. So just something to reflect on a little bit as you're listening to Jessica speak more about the specific approach that's been built out as part of All Our Kin. So Jessica, I'll turn it over to you.
Great. Thank you so much for that fantastic presentation. And let me just say, I have been reading the comments in the chat box, and I am so excited. I wish we could just have an open dialogue for the next 3 hours. But I know that time is short, so I'll try to focus. I also see the names of many friends, and I'm delighted to have you on the call and just to be presenting to such a fantastic group. So All Our Kin is a family child care network. We train, support, and sustain family child care providers to give children and families the foundation that they need for success in school and in life. I don't need to spend a lot of time with this group in talking about why we believe that family child care is so valuable and so critically important, but I will share with you that we have really found that our work has outcomes on multiple dimensions, because the child care providers that participate in our network see that they have increased earnings, they have better quality of life, they are better able to support themselves and their own families. We also see the deep impact that creating sustainable quality family child care programs has on parents who are able to succeed in the workforce. And this is especially true for families who have barriers to accessing childcare, maybe because they're working non-traditional hours, because transportation is a barrier, because cost is a barrier, and most importantly, because, as Danielle has shared with us, so many of our youngest children are in family childcare. We're ensuring that our youngest children are getting the foundational skills that will enable them to succeed later on. We work with about 400 family child care providers who are reaching about 2,400 kids. We began in Connecticut in the city of New Haven, and we're now in 3 cities in Connecticut as well as in the Bronx in New York City. And I think it's important to share that our work is going on in a couple of different states, because what we have found is that the work is the work. And so whatever the regulatory system is within which you are operating, I'm hoping that some of what we have to share will be useful to you, although I'd be happy to talk online with anyone who has specific questions about the policy framework in Connecticut and in New York City. So our family child care network really is in some senses a shared services model, in that everything that we do is supporting the educational early learning experiences that family child care providers are able to deliver, as well as the sustainability and viability of their own businesses. So I will give you a very quick overview of some of our services and supports, and again would be eager to follow up offline with anyone who has more questions. But there are a couple of key pieces to what we do. The first is our licensing initiative, where we help family, friend, and neighbor caregivers, those unlisted caregivers, become part of our professional licensed family child care community. We then have an extensive menu of supports and services that we offer through our family child care network, and I'm going to talk more about what those are. We also have a model early Head Start family child care partnership, where we offer early Head Start slots in a subset of our family child care programs. I'm not going to speak much about it here, but it's useful to understand that we have it. And finally, we have a new initiative where we are offering training and technical assistance in our model to agencies in other areas who want to learn from some of what we do. A word on this. We have been working with family child care providers for about 18 years. We are not the only people who do it, and many wonderful practitioners are listening in here today. We've done it a long time. We've made a lot of mistakes, and we've learned a lot from the mistakes we've made as well as from our successes. So where we have an opportunity to share some of those learnings, we've found that there's an eagerness to engage with us. And we also find that where we share our learnings, we learn just as much from our partners about what their experiences have been. So in looking at the chat box, I saw that there was a lot of interest in this issue of licensure and professionalization. So at All Our Kin, we have the great good fortune to implement what we call a toolkit licensing program. What we have done in partnership with other local advocates and educators is to take our state's licensing process and break it down into a series of manageable steps so that everything you need to get licensed is in one place. And by staging it, this kind of daunting process becomes maybe even a little bit fun, in that at every stage of completing what you need to become a licensed family child care provider, you get a box full of goodies and materials to help you move to the next level. So it's a really fun and engaging way to support people in the process. However, I think it's important to stress that the boxes themselves are by far the least important part of our licensing support. What really matters is that we have folks on staff who are cheerleaders and coaches and friends, and who really help someone who is maybe new to this licensing process understand how it works, help her send in her form, help her know where she can get her fingerprints, where she can get her required health screenings, and also communicate with the state to make sure that her application is moving forward. And I'm happy to speak more about that. Once someone becomes licensed, they graduate to our Family Child Care Network. And this is a profound moment, because we often find that for an unlisted provider, becoming a licensed family child care provider feels like a real reframing and redefining of their work, so that they are able to take pride, as they should, in the incredibly important work that they are doing as professionals and educators. And as members of our network, they are truly respected as educators and have access to the very best that we know about how to support them as teachers and business people. So that includes educational consultation from a mentor coach who will come to a family child care provider's home, model lessons, observe the provider in action, reflect back what she sees, really be a partner for her and a critical friend in this difficult work. Lots of different kinds of trainings, including the Child Development Associate training, series and workshops, which always contain certain foundational components about things like child development, but also include the latest we know about what children need to learn to be successful. So for example, we're doing a lot of work now around attachment, around children's social emotional development, and around trauma-informed practice. We give scholarships for college courses. We offer business training, which we think is incredibly important, because as many of you have noted in the chat box, this is a really hard job. It is a hard way to make a living. We are losing family child care providers across the country, and we need to do everything we can to build up and sustain these businesses, both because families need them and because providers deserve to earn a living wage for the really important work that they do. So we have a proprietary business training, and we offer business coaching as well to work with folks on things like contracts and policies. We offer lots of networking and peer mentoring. I saw a note in the chat box about how providers need different things at different stages of their journey. No question. We have incredibly experienced, skilled providers who mentor others and play a really important role in supporting the development of newer family child care providers. And we have a big annual conference. It was just this past Saturday, where we bring together caregivers to learn, to grow, to be inspired, and to be honored in this incredibly important work. I will say very, very quickly before I move on to the next slide that I saw a question about connection to information. That is definitely a role of our network as well. We're able to blast out information about news that is coming down from the state, for example, so that providers really understand what's happening. We have a partnership with local leadership, local government, so that, for example, family child care providers can participate in sessions where they can give feedback on what's coming down at the state and at the local level. And I also want to add, because I know there are a lot of groups like Child Care Resource and Referral Agencies on the call, that All Our Kin does not operate in a vacuum. We look for all the partners in every city where we operate, including most definitely CCRNRs and others, and we really leverage those supports, and sometimes we're able to act as a bridge for family child care providers and families who may not know about some of the wonderful things that exist in their communities and actually make some of those connections. So what's the secret sauce? Well, I'll tell you what we believe. We believe that for our work transforming the quality and sustainability of family child care to be successful, we have to take a strength-based approach. Family child care providers are doing incredibly difficult, important work with very little recompense or respect, and they are doing it really well. We need to give them the best tools that we know of if we want them to be able to deliver quality over time. And we need to recognize both the difficulty of what they do and the passion and the caring that they bring to it. I think that not for anyone on this call, but that in our past history, we have at times thought that we could deliver maybe substandard training and make an impact. What we see at All Our Kin is if we want to impact quality, if we want to impact sustainability, we have to really hold ourselves as to a level of excellence, and only then can we ask the same of family child care providers. So what are some of our best practices? Number one, again, this strength-based approach. How do we respect the work of family child care providers? How do we build strong mutual relationships? And how do we make sure that if we are asking someone to meet a high level of quality, we are holding ourselves to that standard and we're keeping the promises that we are making about the services we're going to deliver? So this speaks to holding ourselves to a standard of excellence. We take a holistic approach, and that means that we're always figuring out what family child care providers want and need, and then attempting to respond to those needs. And I'll give you just a couple of quick examples. We heard from many of our family child care providers that they were struggling to get small loans that they could use, for example, to fence in a playground, build a little quiet corner, put in a bathroom so that they didn't have to take all 6 children upstairs anytime one child needed to use the bathroom. So we were able to create a zero-interest loan program for our caregivers. Another example, we heard from family child care providers that often they didn't have access in some of their neighborhoods to healthy food for children. So we were able to partner with a local organic farming project to create container gardens where providers could actually grow vegetables and share those with children and families. Find and leverage existing community strengths. This is a big one. Our work is never going to replace everything that can or should exist in a community, but if we find partners from pediatricians to mental health practitioners to programs that serve parents like individual development accounts, job training programs, food banks, if we can find these resources and again be the bridge between these resources and family child care, we find that it makes an enormous difference to children and families who sometimes are very disconnected from existing supports and services. If you have, a young parent, if this is her first child, if she doesn't have a large social network of her own, I cannot over-describe the role that family child care providers play in mentoring and supporting parents. And this, again, goes to my last point, which is when we give providers these tools and knowledge of these resources, they pass them along to parents, and it makes a really extraordinary difference for the whole community. So what are some of the outcomes of our model? First of all, quality. We conducted an external evaluation of our family child care programs, comparing them with demographically matched non-All Our Kin programs. We used the Family Child Care Environmental Rating Scale, and we also used a tool called the Piccolo, initially designed for parents, that's all about interactions and relationships. we found that our providers scored significantly higher on these tools, which do correlate with better outcomes for children. In fact, on average, they scored 50% higher on these measures of quality. And we ran every variable, and the only variable that made a difference was participation in All Our Kin. We also found, we were really excited to find, that these differences were highest in the areas that we believe had the greatest impact on children's learning outcomes: teaching, listening and talking, interactions, and support for children's cognitive development. Increased education. I am so thrilled by the fact that over 50% of the providers that we help to become licensed go on to receive either their associate's degree or their child development associate credential. And I think this speaks to the tremendous hunger and appetite that family child care providers have for training and for knowledge, as well as for the very exciting impetus that licensure can provide for someone who now truly believes that she can go on to get that credential. And I saw, Joe Peralt, that you raised this question around barriers to licensing. We come up against many of those in our work, and there are many that we are able to actually help providers navigate as part of our toolkit program. And there are others that are really more structural, and that's where some of that local advocacy work comes in, where we can, helping to navigate, for example, a relationship with a homeowners association or with a landlord or with a public housing authority so that someone can become licensed. Increased supply. So we are losing family child care providers across the country, and you'll see on this slide that that trend has been going on in Connecticut for some time. This is data from when All Our Kin was just in New Haven, and you'll see that the trajectory in New Haven was very, very different, both because we were bringing new family child care providers into the field through our licensing initiatives, and we were helping them to stay there and to stay open. One thing that we saw as part of our quality evaluation that I didn't put on a slide for you is that we found that All Our Kin providers were much more likely to say that they plan to remain in the field for a long time. In some cases, writing in things like, as long as my body will keep going, as long as God will let me. And I think in part that's about our business supports and helping make this a viable job for someone to do over time. And in part it's that sense of connection to a broader community of other caregivers as well as to All Our Kin staff. Increased earnings. So folks who come to us to become licensed tend to earn very little when they begin with All Our Kin. After the first year, nearly 60% earn at least $5,000 more. Second year, over 45% report earning at least $10,000 more. So significant impact on provider earnings. And the University of Connecticut took a look at this increased earnings as well as increased supply of child care for working parents and found that every dollar we were investing in our newest caregivers was returning $15 to $20 to the community in the form of increased taxes paid, increased spending, reduced dependence on public benefits. So as I said before, the model of investing in family child care is a win-win-win because it is so transformative for caregivers, for parents, and for children. And I reiterate that just in case you need some messaging to take to your local legislators, policymakers, funders as you think about the work. I think the triple win is one of many reasons why this work is so valuable and important. So just very quickly, the next steps for All Our Kin, we have about 4 of them, and I'm going to share them with you both so you can think about maybe how to partner with us, but also because they may be relevant to your own work. So the first is we do have a shared services model, but we are, with funding from the state of Connecticut, beginning to think about another piece of what is traditionally thought of as shared services. That is an online platform that our caregivers can use to track things like enrollment and earnings and really manage some pieces of their program in different ways through technology. We are really excited to have the opportunity to do that, and we're going to learn from some of the leaders in the field who have been doing really exciting work in this area. And again, that's part of really helping providers build sustainable businesses. We're going to be creating more all-our-kin networks in places where nothing exists. It was really exciting to me to come into the Bronx and to see that the appetite for training and support by the family child care providers there was so enormous. The enthusiastic reception we received was huge. And so to someone's earlier point in the chat box, do providers want training? We have found that family child care providers are incredibly eager for opportunities to learn and to grow and to come together with others in community. And it's great to see that that continues to be the case. Train others. I talked about this a little bit. We're working with a cohort of agencies in New York City. They do amazing work. They're deepening their coaching practice through working with us. We also did training in New York City around our business curriculum. So there's a cohort of folks that's going to be taking that training out to family child care providers across the city. And finally, what we're calling creating the conditions for quality care. And someone spoke to this as well. You know, there are so many barriers that inadvertently get in the way of family child care providers, whether it's barriers to licensure, whether it's that the subsidy rates are too low. All these different things make it tough to do what is already a tough job. And so we really want to be part of convenings like this one. We want to be speaking out, giving providers advocacy opportunities, and giving parents advocacy opportunities to shape a system that works for them. So we are already at 3:08. So I am going to stop now, but I'm just going to share that we are pretty active on social media, so I hope you will follow this and follow us, and also please feel free both to follow up with questions to the moderators who can send them to me, but also to reach out to me directly, and I'd be happy to follow up with you about any aspects of our model. Thank you.
Thank you so much, Jessica. That was really invigorating, and you covered such a tremendous amount of information, so thank you. I'm going to throw a couple of questions at you. Did a great job covering lots of questions that were in the chat box. There's just a couple that in particular, as we're thinking about some of what we know around what providers need to deliver quality care, some of the things that you impacted and, or raised as your impact, dig a little bit deeper. So there was a question in particular about what do you think accounts for the increase in earnings? Is it specifically a stipend from AOK, or is it due to the increased number of enrolled children? Can you speak a little more on that?
That is such a great question, and I think it really speaks to a couple of different things. So the first is that once providers become licensed in the states where all-our-kin operates, they can legally care for more children. So that's number one, is the enrollment, right? Number two actually has to do with one of those policy issues we spoke about, because in Connecticut, the amount of subsidy that a licensed family child care provider gets per child is a lot more than the amount of subsidy that an unlicensed family friend and neighbor caregiver receives. So that accounts for a big part of the difference as well. The last thing I will add, though this is above and beyond the licensing impact, it's fascinating to me that providers in our business coaching program see an even greater increase in earnings. And I think that has a lot to do with being able to plan ahead for vacancies, making sure they have waiting lists in place, thinking about marketing, and also thinking about how to reduce costs and keep more of what they earn.
Thank you for answering that. So I've got another one for you, and I think you might have spoke a little bit, but maybe a little bit clearer for us on how providers are selected to be part of the network.
So our network is wide open. We meet people where they are, and we welcome anyone who wants to engage with us in this journey. The word of mouth on our network tends to spread really fast. We often get asked not how we select people, but how we do outreach to people. And, you know, there are many ways we do that, including working with trusted partners, faith-based organizations, job training organizations, schools. But word of mouth is the number one way, right? If someone walks in the door and has a good experience, she comes back with friends. In terms of selection, we support anyone who wants to participate in our services. But within that, there are certain programs for which you have to qualify, typically through your commitment. So the providers in our Early Head Start program make a shared commitment to meet those standards, knowing that the success of everyone in the program depends on their willingness to meet those regulations. Providers in our coaching program need to commit to be present and engage with the coach and actually, be part of this shared journey. But the network as a whole, it's really wonderful that we're able to say wherever you are, we'll engage with you and support you.
And I think that is an important piece, and I think we'll hear about it too on our part 2 of our FCC, which is July 9th, is this idea of kind of the commitment or the engagement, and that providers are committing to and engaging in a process, right, and engaging in a growth, and they're in different places, no doubt, and we're not expecting every provider to necessarily end up in the exact same place at the same over the course of only a 12-month period, but instead we still are, they are bringing something. It's two-way. It's not as if networks are just pouring into providers, but it is about that partnership and them working on their best practice and increasing their quality and really supporting them in that effort. And I think that's something we hear across, and how you engage them in that partnership really speaks to how efficient the network is in seeing successes in the quality of family child care through its providers. I think that's something we hear nationally from the work. So we are very close to the end of time. I want to thank both Danielle and Jessica for this robust discussion. I am just so excited and energized. We had over 300 of us together on this webinar, and I felt like we were in a room of 30. I mean, it was just so exciting to be part of such a robust discussion. I see folks still sharing via chat, sharing each other's contact information. I wanted to let you know that we are, as I said, we're going to pull down the chat, and we will do our best to map some of the resources to some of the questions that maybe we haven't had a chance to answer yet. Some of them are already on the landing page. There are some resources. There's actually a fair amount of resources already, but you might find out that there's even more, and we will take an opportunity to pull on more resources to answer questions that we haven't answered yet. Since Jessica has had an opportunity to kind of have a closing thought as she wrapped up the All Our Kin presentation, I wanted to give Danielle an opportunity to have a closing thought for us, or reflection on the FCC work, as she's been such a pillar of that work for the BUILD organization.
Thank you so much. I echo your enthusiasm, Gina. It has just been so wonderful to be on this call, and it really felt intimate despite the large number of people we had with us. I think my one takeaway is that family child care providers are dedicated and passionate professionals who love what they do. They love our children and take care of them, and they're often overlooked and undervalued. And the new CCDBG funds provide us with new opportunities to support and recognize their hard work. I think that's what I take away from this.
Thank you. And so don't forget, July 9th is the second part of the series on family child care, and then we are doing other webinars that think about supply and quality, and there was a couple folks mentioned Early Head Start Child Care Partnerships as a great partner for family child care. We will be exploring that as a resource as well, broadly for supporting infants and toddlers. So please try and join us for as many of the webinars as you can participate in, and check the landing pad for the resources and the sessions that maybe you're not able to join into. Thank you all so much. This has been wonderful, and we promise that you will see more resources available to you through the landing page. Have a great day.